American kids have become increasingly unhealthy over nearly 2 decades, new study finds. The health of U.S. children has deteriorated over the past 17 years, with kids today more likely to have obesity, chronic diseases, and mental health problems like depression, a new study says. Much of what researchers found was already known, but the study paints a comprehensive picture by examining various aspects of children's physical and mental health at the same time. Quote, the surprising part of the study wasn't any single statistic. It was that there's 170 indicators, 8 data sources, all showing the same thing, a generalized decline in kids' health, unquote, said Dr. Christopher Forrest, one of the authors of the study published Monday in the Journal of the American Medical Association. Health Secretary Robert F. Kennedy Jr. has brought children's health to the forefront of the national policy conversation, unveiling in May a much anticipated Make America Healthy Again report that described kids as undernourished and overmedicated and raised concerns about their lack of physical activity. But the Trump administration's actions, including cuts to federal health agencies, Medicaid, and scientific research, are not likely to reverse the trend, according to outside experts who reviewed Monday's study. Quote, the health of kids in America is not as good as it should be, not as good as the other countries, and the current policies of this administration are definitely going to make it worse, unquote, said Dr. Frederick Rivera, a pediatrician and researcher at the Seattle Children's Hospital and UW Medicine in Seattle. He co-authored an editorial accompanying the new study. Forrest and his colleagues analyzed surveys, electronic health records from 10 pediatric health systems, and international mortality statistics. Among their findings, obesity rates for U.S. children 2 to 19 years old rose from 17% in 2007 to 2008 to about 21% in 2021 to 2023. A U.S. child in 2023 was 15% to 20% more likely than a U.S. child in 2011 to have a chronic condition such as anxiety, depression, or sleep apnea, according to data reported by parents and doctors. Annual prevalence rates for 97 chronic conditions recorded by doctors rose from about 40% in 2011 to about 46% in 2023. Early onset of menstruation, problems sleeping, limitations in activity, physical symptoms, depressive symptoms, and loneliness also increased among American kids during the study period. American children were around 1.8 times more likely to die than kids in other high-income countries from 2007 to 2022. Being born premature and sudden unexpected death were much higher among U.S. infants, and firearms-related incidents and motor vehicle crashes were much more common among 1 to 19-year-old American kids than among those the same age in other countries examined. The research points to bigger problems with America's health, said Forrest, who is a pediatrician at the Children's Hospital of Philadelphia. Quote, kids are the canaries in the coal mine, unquote. He said, quote, when kids' health changes, it's because they're at increased vulnerability and it reflects what's happening in society at large, unquote. The timing of the study, he said, is, quote, completely fortuitous, unquote. Well before the 2024 presidential election, Forrest was working on a book about thriving over the lifespan and couldn't find this sort of comprehensive data on children's health. The data sets analyzed have some limitations and may not be applicable to the full U.S. population, noted Dr. James Perrin, a pediatrician and spokesman for the American Academy of Pediatrics, who wasn't involved in the study. Quote, the basic finding is true, unquote, he said. The editorial published alongside the study said while the administration's MAHA movement is bringing welcome attention to chronic diseases, quote, it is pursuing other policies that will work against the interests of children, unquote. Those include eliminating injury prevention in maternal health programs, canceling investments in a campaign addressing sudden infant death, and, quote, fueling vaccine hesitancy among parents that may lead to a resurgence of deadly vaccine-preventable diseases, unquote, authors wrote. Officials from the U.S. Health and Human Services Department did not respond to a request for comment. Forrest said risks highlighted by the MAHA report, such as eating too much ultra-processed food, are real but miss the complex reality driving trends in children's health. Quote, "We have to step back and take some lessons from the ecological sustainability community and say, let's look at the ecosystem that kids are growing up in, and let's start on a kind of neighborhood by neighborhood, city by city basis, examining it," unquote, he said. The Associated Press Health and Science Department received support from the Howard Hughes Medical Institute's Department of Science, Education, and the Robert Wood Johnson Foundation. The AP is solely responsible for all content.